Good morning. I'm Anne Gates and I'm a member of the World Heart Federation's Emerging Leaders Programme, and in conjunction with the British Association of Sports and Exercise Medicine, I'd like to introduce the concept of training tomorrow's doctors in exercise medicine for tomorrow's patients. So what do I mean by this? Well, the Tomorrow's Doctors guidance is very clear in specifying the education needed to produce doctors of world-class standards. This document is essential in providing the structure for not only undergraduate but also postgraduate education in the training of those future doctors. And one of the key duties is actually to promote and protect the health of patients and the public. This guidance was produced by the General Medical Council in 2009 and serves as a useful framework for aligning exercise medicine with the future care of patients. One of the key areas is the prevention and treatment of heart disease and stroke. This fits with not only the World Health Organization's 25 by 25 goals, which is absolutely pivotal, and is something that is championed by the World Heart Federation and identifies very specific targets to be reached by 2025. And those targets specify a 25% reduction in deaths from cardiovascular disease. One of those key targets is a 10% reduction in physical inactivity. Now, we know physical inactivity is directly linked to immobility, disability and death. And a nice editorial in the British Journal of Medicine by Elizabeth Badley clearly demonstrated that this year. So why do we need this paradigm shift in the training of our doctors and also in practice? It's because we have a very medicalised approach to medicine based solely on drug use and drug prescriptions. And what we need to do is to move to a much more proactive health prevention model. And why do we need to do this? Well, we need to change the paradigm, we need to change the pattern, because we have 37,000 patient deaths in the UK each year solely from inactivity. And this is unacceptable in 21st century medicine. And in fact, these are names and faces in every clinic waiting room, and they're very clearly preventable deaths. The World Heart Federation says that up to 80% of all cardiovascular deaths are indeed preventable deaths. It's time to train our doctors to prevent those deaths, and it's time to train our doctors to become proactive in exercise medicine. What we've got with at the moment is a global situation. It's a global health crisis of physical inactivity with actually no medical support and with huge social determinants of health playing into the burden of mortality. I think it's time to teach every health professional on exercise is medicine. We need to link in the inactivity and obesity crisis into our understanding of chronic inflammation and how that manifests itself into chronic diseases or non-communicable diseases, or NCDs as they're now called. This links very clearly to the rising incidence of type 2 diabetes, atherosclerotic diseases such as cardiovascular disease, and also the future burden of Alzheimer's disease, dementia and cancer, which we know are going to increase by 2025. The evidence for exercise is medicine is out there. It's very explicit, it's very expansive, and it also serves as a scientific and scholarly basis for providing exercise as a medicine every consult. And so really we have to ask the question, is it not time to teach every health professional in exercise is medicine at undergraduate and postgraduate levels? To do this, we would require a superhuman effort. And actually, this is a call to action to all the governing bodies and clinical bodies to recognise that the world is in crisis around inactivity, obesity and non-communicable diseases. And the support of the British Association of Sports and Exercise Medicine in conjunction with all these other organisations is absolutely essential to address the undergraduate curriculum needs. This requires a superhuman effort. From the NHS's perspective, we need to utilise the framework of making every contact count for physical activity advice. This ensures that every health professional who comes into contact with a patient provides physical activity advice as part of everyday consultations. And what do I mean by this? This means a concerted effort across the NHS of providing cradle-to-grave care, in providing teachable moments. And I particularly like this phrase. It comes from the All-Party Parliamentary Commission's report into physical activity. And a teachable moment is defined as that interaction, that life-changing interaction that occurs between a health professional and a patient to improve their understanding of why the health professional or doctor is asking them to exercise more. And these teachable moments need to be throughout the life course and throughout a patient's journey. So not only during childhood and adolescence, but also moving throughout life from cradle to grave care, and providing these teachable moments so that all patients have an automatic opportunity to access greater life in their years and added years to their lives. So what does this mean in reality? Let's just think about this. If every trained health professional, and in the NHS we see over 1 million patients every 36 hours, gave physical activity advice at every consult, that means an awful lot of physical activity advice is being supported in practice. And actually we've got just under 700,000 doctors and allied health professionals within the NHS who could be giving brief physical activity opportunities and support to patients every NHS day to every single patient. Now let's just think about that. Let's just reframe that and see what that feels like. That is an awful lot of support and education and concordance and direction between health professionals and a patient, giving those teachable moments and exemplifying that exercise is a medicine, and we need to treat it as a medicine and prescribe it as a medicine and monitor it as a medicine. And one of the key things within primary care is that this approach is already covered by the NICE Public Health Guidance PH44, which specifies brief advice works within primary care consultations. And what we need to happen is for an appropriate structure, an appropriate framework similar to the PH44 guidance, which occurs in secondary care, hospitals and tertiary care. This has to be education by design. We have to enable all patients to access suitable exercise opportunities throughout their life course. And this requires us to not only develop, but also to inspire a generation of doctors understanding and learning at an undergraduate and postgraduate level. This is not for the faint-hearted. This is a call to action for ambition. This is not my vision of my superheroes in developing an exercise medicine course. We need to identify those people that can and will deliver on this future vision. This is not about my or your resources. This is about the pooling and sharing of all our resources, all our available educational skills to enable tomorrow's doctors to provide the best quality, safe and effective exercise advice to our future patients. So what we've done is we've got together an expert team, and by expert I mean leaders at a national and international level on exercise medicine and chronic diseases. I myself are leading this team, but it includes Dr. Brian Johnson, who was pivotal in developing the world's first continuing professional development for general practitioners around exercise medicine and chronic diseases, entitled Motivate to Move. Dr. John Brooks and the medical team from King's College London, who have already initiated some undergraduate training courses. Mr. Chris Oliver, who's a surgeon from Scotland. Simon Rosenbaum, who's an exercise physiologist from Australia, who actually specialises in exercise physiology and support for patients specifically with mental health, severe mental health and type 2 diabetes. Dr. Jane Thornton from Canada, who is just initiating a similar undergraduate training programme in Canada and also North America. Mr. Ian Ritchie, who's the president of the Royal College of Surgeons in Edinburgh. Stephen Griffin, who's an undergraduate student in medicine. And together with the very fantastic support from Nottingham University Medical School, specifically Professor Ian Hall and Professor James Lowe. So together we've united to produce a common goal of an expert undergraduate exercise medicine core curriculum. The purpose of this is to train tomorrow's doctors to deliver safe and effective exercise advice to tomorrow's patients and develop a fit-for-purpose workforce, not only in the UK but globally, and to provide Britain as the source of a world-class exercise medicine approach. We need a legacy from the 2012 Olympics. We need a legacy of better health for our patients. We need a legacy of better trained medical staff and allied health professionals to deliver on this very proactive, preventative health promotion. So we need hope. We do need Supermen. We need the General Medical Council to link in with the Royal College of Physicians, the Royal College of Surgeons, the Royal College of General Practitioners, the Academy. And we need to start asking and identifying needs and also hope. And in conjunction with this superhero theme, I think once you choose hope, anything's possible. And for me, to choose training doctors in exercise medicine for tomorrow's patients is a superhuman effort. I'd like to say thank you and also acknowledge a lot of special people and a lot of superheroes that have helped not only the World Heart Federation, the British Association of Sports and Exercise Medicine, but myself to initiate this important project. And I'd just like to acknowledge that help, particularly with the University of Nottingham, Professor Karim Khan, Dr. Jim House, Dr. Richard Wheeler, and many other good and great people who have enabled this project to be successful. Thank you very much. I'd like you to access some of the resources that we've applied here, and we'd like to now present the Chronic Diseases and Exercise Medicine course that we're proposing.